What's your major here at NYU, or are you a professor?
Yes, I am.
Okay, what do you teach?
I teach pediatric pulmonary.
Okay, do you think you can answer 5 questions every professor in that role should know?
Sure, of course.
I'm going to ask you 5 questions. Each one will get harder if you get it right. What is the difference between the upper and lower respiratory tracts?
The upper tract has more cilia to clear the upper tract. The lower tract does not have any cilia.
Perfect. Good job. 1 for 1. What is bronchiolitis, and how does it differ clinically from asthma?
So bronchiolitis is usually in younger children, inflammation of the airways that happen with a viral illness. And asthma tends to be in older children, allergies causing inflammation as well.
Perfect. 2 for 2. What is the pathophysiology of cystic fibrosis?
Cystic fibrosis has a chloride channel that does not open, and patients have lots of infections.
Yeah, perfect. 3 for 3. I'm going to give you some harder ones now, okay?
All right.
What is the difference between central and obstructive sleep apnea?
So central sleep apnea means the brain stops telling the lungs to breathe, whereas obstructive means that there's obstruction to the flow of air.
Perfect. 4 for 4. Okay, last one. What is the approach to diagnosing and managing pediatric interstitial lung disease?
Okay, so we do CAT scans on these patients to look for areas of inflammation, and sometimes we actually have to do a biopsy of the lung.
Yeah, perfect. 5 for 5. Do you want to try the hardest one for fun?
Yeah, of course.
Okay, let's do it. How do genome-wide association studies and polygenic risk scores methodologies advance our understanding of asthma?
Well, we're trying to understand treatments for asthma and which are the optimal treatments that can get it under better control without the need for taking steroids.
Amazing. I got to say, you sound very passionate about what you do. What got you into teaching?
I like spreading news to the younger generation so that they get interested.
Yeah, I love it. And last question for you. For anyone that wants to become a professor or even go into the industry that you're in, what advice would you give them?
I would say that it's a fun job to do, and it's worth doing because kids get better. That's the good news.
I love it. Thank you so much for your time.
All
It was
right,
great to meet
pleasure.
you.